Cynthia's asking the question, saying, is depression a symptom of right brain deficit? The answer is no. Neurologically, depression is actually happens in the frontal lobe of the brain. Okay, let me differentiate. And it happens mostly in the left hemisphere. The left hemisphere frontal lobe is deficit. And that's the major area of depression. Okay. What I'm saying is that if we think of those areas of the brain not functioning properly, the left frontal lobe is not functioning properly, why is it not functioning properly, right? And we tend to think of poor energy in the left frontal lobe. Okay, function. Why does a person have poor energy? Okay, underlying metabolic regions, hormones, thyroid, and the inflammation in the gut. The inflammation, if it's exaggerated, the inflammation goes to the brain and then begins to affect that area. So what I'm saying is that when you're starting to treat a person, you not only have to activate the left hemisphere to activate those areas, but you can't activate those areas when that area is fatigued. You can't activate those areas when the brain is inflamed, causing the fatigue. So you have to do this in a methodical step, right? So that you have to begin to downregulate the inflammation first. So if the analysis shows that there is a right hemisphere deficit, right, you got to deal with that first, right, to then be able to integrate the right and the left brain. Does that make some sense? So right brain first, to activate your vagal nerve, to activate your parasympathetic nerves, to improve your gut health, to begin to downregulate the inflammation. Then you can kind of downregulate the inflammation. Then that gives you an opportunity to come in and then do very specific exercises to strengthen the area in the left hemisphere where the depression is basically happening. And that person can then tolerate those exercises. Okay. I'm just saying because I'm at a long time. I made my mistakes, which is why I still go to courses today, right? So going back 10 years ago, I learned lessons when I was trying to do some of these brain exercises and trying to activate these, let's say the left frontal cortex of the brain to help depression, before I really addressed the underlying inflammation and the things that were creating an energy deficiency. So that when we were doing these stimulating exercises, the brain was not capable of handling that stimulation. Medically, that's a term called exceeding metabolic capacity. What that really means is you're giving exercise to an area that can't handle it. And that actually causes those areas, those brain cells called neurons, to fatigue faster. Not good. So I've learned you can't go and jump ahead. You've got to go back, right, and do things in the right order, the prioritization, right? If you're looking at lab tests, functional lab tests, my job is to pull away from those lab tests and to cross-correlate it to the person I'm working with, and not just spit back what a lab test says, but to how do I take that lab test and really read between the lines and interpret it based upon what the patient's symptoms are, what their signs are, what they're doing, what's working, what's not working, and how do I help prioritize, what's going to be most effective, and which helps the individual person be able to apply those things. So you have to be able, from my perspective, be able to prioritize, be able to get a person who's I'm working with to understand the prioritization and why we're doing certain things, and be able to get them to, to be compliant and do that. And so, that just comes from to be able to understand it and be able to articulate it to the person appropriately.